Hi, this is Judy Saalinger from Lasting Recovery, San Diego's premier outpatient alcohol and drug treatment center. And today we're talking about cross-addiction is when a person is addicted to more than one substance. And oftentimes we see people come in who may be alcoholic, but they've also been prescribed a benzodiazepine for their anxiety disorder. And they may also take a sleeping pill for their sleeping problems, both of which are related to the ingestion of alcohol. And what we find is that when they get sober, that their sleeping improves after a fairly short period of time. If not, there are some non-addictive medications that can be prescribed. The issue is that benzodiazepines, of which is part of Ativan and Xanax and some of the other medications that are prescribed for as an anti-anxiety medication, act on some of the same receptor sites as alcohol does. So what happens is that people think that they're sober from alcohol, but they've just put their dependency more on the other medications. Now, sleeping pills like Lunesta and Ambien, people say, the manufacturers should say that they say that it doesn't resemble a benzodiazepine, but most people have the same sort of effects as one would from a benzodiazepine. And we find that from our perspective, if a person stays on those drugs after they've stopped their alcohol use, that they will relapse. And our goal of treatment is for this to be a lasting recovery. We want you to have enough information, enough skills, enough support for you and your family so that you don't have to come back again. And if you do, we don't want it to be because of these other substances that people weren't educated about. So when someone comes in for treatment, I want to encourage one to be prepared to let go of those substances that also have become addicting. Another one is marijuana. And that we find probably 60-70% of the people who come in for treatment are also using marijuana. And so when we do the drug testing, we can see that the THC levels are coming down or they're going up, because we do random drug testing in our program. So the idea is that if you want to be clean and sober, if you want your life back, if you want to live by your value systems and have the life that you deserve, then be willing to let go of all the substances and learn to find other rewarding ways of calming your anxiety and learning how to put yourself to sleep. We've not been used to doing that when we're using substances, but nature makes it such that you can put yourself to sleep and you can learn to relax. So thank you for listening.